Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to talk with you about a test called a urodynamic study. In this video, I'm going to discuss the purpose of the urodynamic study, how the test is performed, and what are the risks and complications of a urodynamic study. First of all, let's look at the purpose of a urodynamic study. The purpose is to identify what are the causes and problems associated with difficulty with urination. Most commonly, the problem of urinary incontinence, where a man or woman loses urine before they can get to the toilet to adequately empty their bladder in a timely fashion. The study also helps to define the problem and also to help with the treatment of difficulty with urination or urinary incontinence. Now, how is the test performed? The test consists of the insertion of a very small tube or catheter through the urethra into the bladder. If you're a woman, another very small tube is placed in the vagina, or if you're a man, the small tube is placed into the rectum for a very short distance. In addition to that, you will have some electrodes that have a sticky substance to attach the electrodes into the area around the rectum to measure the muscles that are associated with preventing the loss of urine. The test consists of a technician who will be in the room, who will ask you when you feel the urge to urinate, as fluid is pumped through the small catheter into the bladder, giving you the sensation that you may have to urinate. The fluid consists of sterile water. You will then be asked when you are at the maximum bladder capacity, when you feel that you cannot hold any additional fluid. At that time, you will be asked to sit on a commode or a potty chair, and you will be asked to urinate over a machine that measures the volume of urine that comes out and how long it takes to expel that volume of fluid from your bladder. This is referred to as the urinary flow rate. Following this test, the catheters are removed and you will get back on the exam table, and a cystoscopy is performed, which allows the insertion of a very small, flexible, lighted tube through the urethra into the bladder to see the interior of the bladder to identify, again, what might be the cause of the difficulty with urination or urinary incontinence. After the procedure, it is not uncommon to have a small amount of burning after urination for 2 or 3 times after the procedure is done. You also may have or experience urinary frequency. Again, this is a temporary problem. Both of these conditions can be alleviated or reduced by drinking a large quantity of fluids, either water or any other beverage, in order to flush out the urinary system after the procedure. Occasionally, you can experience a small amount of blood in the urine, and very rarely will you develop a urinary infection. It is for that reason that your doctor will give you a prophylactic antibiotic to take right after the procedure in order to prevent a urinary infection. You should notify your doctor after the procedure if you experience persistent blood in your urine, if you have significant burning more than a day after the procedure, or if you develop fever or chills, which is indicative of a urinary tract infection. I hope you have found this video helpful and useful regarding the purpose and the procedure called a urodynamic study. I know you may have some additional questions, and I'd be happy to answer them for you, or I would suggest that you go to my website, www.neilbaum.com, and you can find additional information. Thank you.